Good morning. I'm Dr. Qasim Sufi, the Chief of Mission of IOM, International Organization for Migration, the United Nations Migration Agency in the United Republic of Tanzania.
Thank you very much. It's a pleasure to have you this morning on the program. This is the UN radio program, but you are also going to share it with the local media here in Tanzania. First, I'd like to ask you, this year the United Nations is commemorating and celebrating 75 years of its existence. Within this time, what are the key achievements of IOM in Tanzania? And maybe if you could also touch on the global platform.
Yeah, thank you so much, Stella. Very pertinent question. As you know, also IOM is almost 60 years old. So we are, 56 years old. IOM was born, let me put it like that, and maybe 11 years after the UN. And IOM in Tanzania is 20 years old, so 2 decades IOM is. But it grew, so largely, as you know, at the moment IOM is the second largest UN agency in Tanzania. IOM is part and parcel and a very important actor of the United Nations country team, as you know, that has got 15 resident agencies in the country and 8 altogether, 23. So IOM is dealing with migration and migrants issue. I must say that we align our work, or our work is aligned with the UNDAP 2, and that is the global document that put all the work done by the UN agencies in Tanzania that are delivering as one. So IOM is responsible for the migration and migrants. And as per the UNDAP 2, there are many outcomes, as you know. So IOM is part and partial or important actor together with UNHCR of the outcome for refugees and migrants. If I just mention this, for example, IOM is doing what we call resettlement. The resettlement, which is one of the most important durable solutions, of the 3 durable solutions for refugees. IOM is resettling refugees from the DRC, ex-DRC, who are many, actually 100,000 here in Tanzania, into the resettlement countries such as USA, Canada, and Australia, and other countries that are taking refugees for resettlement. We work closely with UNHCR, that is the mandated agency for refugees. Why resettlement? Resettlement is a burden-sharing approach, actually, not only the developing countries that are hosting the refugees, shouldering all the weight of the refugees when they leave their countries, but major countries like the USA, Canada, Australia, and other also share the burden so this is really to share the burden of refugees globally or worldwide. The other durable solution that IOM is implementing under the outcome of refugees and migrants, as you know, it's a very important project supported or initiated by the 2 governments of the United Republic of Tanzania and the Republic of Burundi. So with the support of UNHCR is the voluntary repatriation of Burundian refugees that has started long ago, but lately, after the elections in Burundi, the presidential elections, the peaceful elections in Burundi, now the numbers of refugees that are returning in Burundi are really picking up. We have almost, 2,000 refugees that are going back every week as per. This is now just to go as per the outcome. The second outcome, actually, that IOM is part and partial or within the UNDAP 2 is the violence against women and children. And this IOM is working in the whole country, actually, in mainland, in Zanzibar. I would like just to mention that IOM is running a shelter, actually, for victims of trafficking in Kigoma region. We don't want to disclose actually where it is. And then also now we're starting in Zanzibar. And the other important outcome group that IOM is working within the UNDAP is the governance. So counter human trafficking, as you know, we just celebrated, it's not even a month, and we visited an trafficking in person day, and this was really, the government has participated actively, and it's really taking so many measures to address this issue. And I would like, I mean, when it comes to trafficking and smuggling of people, to say something that many people confuse is actually the two terms of trafficking and smuggling of migrants and persons. They are not the same. Smuggling is really to enable someone, I mean, to enter in a country that it's not his home country, or does not have residence illegally, actually, with fake documents, or hiding him in containers. In many means, the smugglers, what we call smugglers, use is to, while trafficking is different, is to abuse actually someone by deception and by other means, and then to benefit some material from money, material from the person. So this is another huge work that I am doing, and this phenomena is very rampant. Both of them are very rampant in Tanzania. I would like to mention, for example, that, as you know, many Ethiopian and Somali migrants always try to cross Tanzania, which is a transit country, heading to the Republic of South Africa. But most of the time they are detected by the border authorities, by immigration authorities, by police. They are detected as per the Constitution of the United Republic of Tanzania, and they are detained. So IOM support them and work with the government actually to support them while they are in detention, while they are in the court defending themselves, when they are returning back home, and all this. So we facilitate, as you have heard, if you have seen on the TV many times, we facilitate the return, the safe return and reintegration of migrants that have landed, that have been detected by. The other important, outcome group that we are part, and also an important outcome worldwide at the moment, is the climate change. As you know, in Tanzania, IOM secured funding and from the international IOM development fund is called IDF, and we are supporting two projects actually at the moment, and we are in the process of joining the outcome group so that we can work with the leading agency of this outcome group, the UNEP. And of course, because of COVID, as you know, I mean, that affected not only affected the whole world, COVID, but the COVID-19 pandemic that affected the whole world. IOM is an active agency now. We have just signed with the whole United Nations country team an agreement to provide services, actually medical services, to the UN staff and their dependents. So this is what I could, on top of that, as you know, in Tanzania, we have also the EAC, the East African Community Headquarters in Arusha. And I'm not the direct responsible person. It's our regional director, actually, who is based in Nairobi. However, since he's physically not here, I support him a lot, and we have staff that are based there in liaison work with the East African community. Not only that, but Tanzania, as you know, is also part of the Southern, African Economic Community, SADC, and it was not only a founding member, but was also, just handed over to Mozambique now, was the presidency, or was having the chairmanship, the presidency of that economic community, so that one also was another work. On top of that, IOM participated actually in some work, for example, in Kagera, as you may recall, during the earthquake, together with UNICEF. So our work is really aligned with the UNDP, the United Nations Development, which is also aligned by itself with the National Development Plan, as you know, and we are in the mainland and also in the island in Zanzibar, which is Pemba and Unguja. So this is how I could summarize the work of IOM. When it comes to counterpart, we have, as you know, our main interlocutor for all UN agencies is the Ministry of Foreign Affairs, but technically we work more with the Ministry of Home Affairs and with all departments, especially the Department of Immigration, Department of Refugees, Department of Police, Department of Prisons. Because of our work, as I mentioned, some migrants are detained, some migrants have to be returned, and so on and so forth. So, and initially when I started to talk, I mentioned a project. I mentioned to you that IOM is present in 11 regions, and the main reason why we are present in this 11th region is through a huge project funded by ex-DFID, now the name has changed, but funded by the government of the UK, that is registering all migrants, I mean all irregular migrants in Tanzania, with the aim of providing them durable solutions. I mean, those who have got, I mean, concrete and good justification to be in the country, to provide them either work permit or to provide them maybe residence, or to provide them even citizenship if they have, for example, the reason to see. And those who are not able to, how you call it, to sustain themselves, to maintain themselves in the country, to assist them to return home so that they can start better future. And this has enabled us, IOM, to be in all border regions, in 11 border regions in the country. During the COVID outbreak, when it started, IOM was an active member, especially in the port of entry group. And we have done a lot of assessments, and we are currently providing a lot of support to the different ministries that are working, I mean, especially the Ministry of Health and other ministries concerned, Immigration, Ministry of Home Affairs, Police, and all people who are in terms of training.
Maybe thank you very much for all the details that you're providing, but I just wanted to find out on the relationship and the partnership that you have with government. How would you say the migrants have benefited from this partnership, which so far I believe is looking like a very good partnership between IOM and government?
Yeah. As I mentioned, for example, one of the issues related to migrants that happen in Tanzania, which everybody, almost all Tanzanians know, and very famous actually in Kiswahili, uhamiaji wa haramu, you know, uhamiaji haramu, this irregular migration. Many migrants actually try to reach Southern Africa through illegal means, let me put it like that, through smugglers. Smugglers, they take from them money, they prepare fake documents, fake visas, or hide them in containers. And then they try to go through Tanzania. Now, since the system is functioning in Tanzania, I must say, the immigration system is functioning, border agents are functioning, police, and everybody is doing his job. So they are most of the times captured and taken to the court, and then, as per the constitution, they have to either pay money, or what we call fine, or then they have to pay it in remaining in detention. So what IOM does, for example, is really to train the immigration officer to apply all the human side, let me put it, in line with the international laws actually, and international conventions that the United Republic of Tanzania has signed. Not only that, but we provide also support they need, for example, because Tanzania did not budget, let me put it like this, for, I don't know, 1,000, 2,000 migrants to come to Tanzania. So it means the feeding, there is a medical aspect and all this to meet their basic needs. Not only that, but when they finish, for example, as I mentioned, when they finish their detention time and it's time to return, also Tanzania does not have money to return, so it's something that IOM supports, but we promote also the government to join us. Of course, government contribute a lot in this, together with the country of origin. For example, if I mention Ethiopia, for example, let's say the return is by air, it costs a lot of money. So the Ethiopian government, for example, decided lately to contribute 50% of the flight tickets. The 50% is contributed by IOM. So this is what is happening. Not only that, but we advise all countries not to close their borders because of, let's say, because closing borders is not the way you could achieve, or countries could achieve their goal. For example, let's say a war happened in other country. I mean, the solution is not to or maybe you have these irregular people who are trying to enter the country. It's not the thing. So what IOM promotes and support the countries or that where it is based in our member state of IOM is to manage the migration, manage migration. Managing migration, which means simply, to know who is coming in and who is getting out and for which reasons. So for this, it's not easy, especially countries that have got long borders and porous borders, let me put it like that. And so IOM, what it does is to train immigration officers, police officers along the borders, and provide them with equipment. And I forget actually to mention that Tanzania, the United Republic of Tanzania, is blessed to have a center, called ACBC, African Capacity Building Center, that is located in Moshi, in Trita, Tanzania Regional Immigration Training Academy. And this center actually trains all immigration officers in the continent. So, and all, in summary, what they are taught, they are taught many things. I'm not a specialist, but it's really to improve the migration management at the end of the day, which means not to close people. Countries should not close borders. So countries should manage their borders. So they need equipment. They need equipment to detect whether the passport is correct. They need equipment to detect whether the visa is correct, and so far and so forth. And then, so you have to have the means and also the training. If I could summarize now, our support to the government when it comes to migration management, including all these issues that are irregular migration and migration management and border management. It is about training, it is about providing equipment, and it is about designing also policies and also aligning policies, the national policies with the international policies that are existing, so that migration does not become something, because migration benefits everybody, whether it's the producing country, whether it's the transit countries, whether it's the destination countries. As you know, many countries, the non-white collar jobs are done by migrants. That the others do not want to do, the small jobs, and not only that, but this benefits also migrants who get some money to send them back home, what we call remittances. So it is something that, if it is managed, well managed, actually migration is something that benefits all, actually, manage both the sending country or both the remaining country. Since you asked me about the global migration, I must say, is the most important issue at the moment, in the 21st century, because there are thousands and thousands of migrants, as you know, trying to cross either the Mediterranean or through other routes towards Europe for better benefits, and these are people who are leaving their countries, who may be affected by wars, or may be affected by droughts. This is the importance then of climate change also, or who may be affected by political issues, actually, that are not so push the migrants. So in general, what drive young men and young women to live there are two issues, actually. The first one is the insecurity. The second one is also to seek for better, better. But unfortunately, sometimes they are smuggled, sometimes they are trafficked. So IOM tries to, two main strategies is to address the root causes of irregular migration, but also to rescue, those who land in trouble while they are trying to undertake these irregular migrations, while they are smuggled or while they are, as you know, many people die in the Mediterranean. Many people are rescued. So we IOM, International Organization for Migration, the United Nations Migration Agency, try to support. And I would like also to take this occasion, actually, to use this occasion of 75th anniversary of the United Nations to mention the Global Compact for Migration, Global Compact of Migration, that was signed in Marrakesh in Morocco in 2018, which promotes actually the safe, orderly, and regular migration for the whole world. Almost all the countries in the world are members, with the exception of few countries. And IOM really, this is our the IOM main milestones, and it could contribute positively to the SDGs, the 17th migration. I mean, governance, for example, can contribute to all 17 global goals so that we have, and we are trying actually to promote also within Tanzania to the global compact of migration with the government, and also to contribute by using them and by promoting them to promote the SDGs, the global goals.
So thank you, but we also need to look at the trends of migration. We've seen, for example, globally, if you look at the United States of America, there's a lot of people coming from South America trying to get into the US. But here in Tanzania, how would you describe the trends of migration, and also in terms of the gender, the reflection on the gender trends also? Do you have so many women who are also part of the people who are being trafficked, or part of this trade?
No, thank you, Stella. This is very, very pertinent question. Actually, it's exactly, I mean, what you are saying. Actually, I must just simply confirm. Most of the victims of trafficking are women, actually, and then you have some children, and most of the victims of trafficking are from Africa, actually, I must say, and most of the victims of trafficking are from West Africa, followed by the East African and Horn of Africa. So I mean, it's something that really affects, I mean, Tanzania. And there is also, I mean, internal, how you call it, trafficking. It's not necessarily someone who is brought from other countries. There is also internal trafficking. I think there are people who do not understand. That is why it is very important for people to understand, especially the journalists, because they are the one who can assist to how you call it, to share the word, let me put it, with everyone in the community, through mass media, through newspapers, through. Unfortunately, the most affected victims are women. They are promised, let's say, for work, and then when they come to where they are brought, they are, for example, forced to do some other thing, including prostitution. So this is a very, very important violation of basic human rights that IOM is working. So I must say, I mean, we experience this smuggling of human, but Tanzania is not free from human trafficking. It is, I mean, there is human trafficking also in Tanzania, and the victims are predominantly women. Mainly they are promised for jobs, but it happens also for abroad, as you may have heard. I mean, there are many people who are promised jobs in Gulf states, and they land in trouble. For example, COVID exposed really, I mean, the many, not only irregular migrants, but also regular migrants. Many of them have been abandoned. I mean, after these lockdowns, there are many migrants who are suffering worldwide, especially in these countries where they were seeking for jobs. So this is really an important point that you raised, especially when I relate it to COVID-19 pandemic that is going on at the moment. It has affected badly even regular migrants who had their jobs, who had everything, who had their salaries in many countries. But imagine now all those irregular migrants. This has increased now the abuse of victims of trafficking and others, even that those who have gone. So it's something that we really need to take it serious, and to give particular attention at the moment because of the COVID pandemic, because as you know, the measures to prevent COVID is social distancing, the lockdown, don't move, and all this. So they lost any value for the people.
And in terms of the numbers, do you have any figures to go by, like per year, how many migrants are you managing?
Actually, in Tanzania, I really don't have a number that I could share with you. We have actually many migrants. I mean, it's in terms of thousands, of course. It's not a matter of hundreds. I'm talking about thousands of migrants who are either smuggled or trafficked, that United Republic of Tanzania. And it is obvious, actually, because Tanzania is in crossroads. Let's say you cannot, I mean, from Somalia, from Ethiopia, you cannot go to South Africa unless you fly, so you have to cross Tanzania. This is in terms of smuggling. Trafficking the same, actually. Trafficking the same. Many people have been from neighboring countries again brought here, not only within the country, actually, as I said. We're talking about thousands, but I really at the moment don't have, I have to ask then the colleague from the program.
So when, when these people, the migrants are arrested, where do they say they're going to? I mean, what is prompting them to go where they're going to? Because we all know there have been issues around xenophobia in South Africa. What do you think is happening now? Where young people or older people from these countries like Somalia, Ethiopia, still going to South Africa?
Thank you, Stella. This again, I mean, is a very, very important and pertinent question, a very valid question. And I mean, young men finish their education and there is no work, for example. This is a social, let me put it, social factor. The other important factor that is contributing is the instability, let me put it like that. Instability, many countries, I mean, political instability, I mean, you have people fighting each other because of, if you look at the migrants from Ethiopia, for example, they are predominantly coming from one region that is affected by instability. The same thing, I mean, Somalia, there is no region. I mean, there are some regions that are, if you look at Somaliland, for example, it's peaceful. But the southern part of Somalia, I mean, you hear every day, so people are running away because of their lives or for for greener pasture, let me put it like that. So these are the two main driving factors. So that to address this, you need really to address the root causes, and this is what IOM is trying to do it together, of course, with the government. IOM cannot do it, can only support if the government requests, or I mean, in terms of advisory, in terms of providing technical support to address the root causes. So it means to stop the factors that are driving. Xenophobia is not only in South Africa, it's now really became a cancer, let me put it like that, metastatizing everywhere. And it's something that we are trying to address. I mean, you hear, you see, I mean, everywhere lately that the world, I mean, is against this discrimination, also a very basic human right as trafficking. And unfortunately, we have all these challenges. IOM is trying to address them together with the member states. Every time it happens, people lose lives, people get injured, people get, psychologically affected due to discrimination, or because of their race, or because of their status, because they are migrants, because they are just seeking something basic to survive and peacefully. They didn't come to any country to create problems, so they are discriminated, and because of their status, because of their race, because of their gender sometimes. And so it's something that is the reality of 21st century, and it is becoming just more and more. And not only that, unfortunately, some countries are making even a political agenda actually so maybe they promote, I mean, closing, borders, stopping migrants and all this, unfortunately, yeah.
Earlier you mentioned a little bit about COVID-19, or coronavirus disease, which is affecting the whole world differently. But here in Tanzania, I would like you to mention how you see COVID-19 has affected migrants and what you have done about that as IOM to support the fight against COVID-19.
Yeah, no, thank you so much, Stella. We are part and partial, as you know, in the UN country team. We are part of all the appeals, and our work was focused initially on the port of entries. Why port of entries? Because it's where the migrants, the refugees. I could give you a concrete example what we are doing for the migrants at the moment. For example, despite the COVID-19, the VOLREP, the voluntary repatriation program to Burundi has never stopped, actually, as you know. I mean, it has been There was a time, I mean, but that was not because of COVID, but was because of maybe election and some funding issues sometimes back. So what we do, we apply all preventative measures when we are doing. Anyway, IOM, even before COVID, what we do, what we call fit to travel. Because fit to travel means it's not that IOM just takes a migrant or a refugee and put him or her on a plane or on a bus or on a boat, because IOM use all means of transport to facilitate the how we call it, the return or the resettlement of refugees and migrants. So what we did is, for example, apart the routine pre-departure medical screening with him, which includes mainly to ensure that the person is fit to travel, which means he doesn't have something that will harm his health or to harm other passengers or other migrants or refugees who are traveling with them. So no communicable diseases. Not only that, among migrants you have people who have got HIV/AIDS, for example. There are people who have got other diseases, chronic diseases, high blood pressure, sugar, tuberculosis, so many things. We ensure that the person has got really the treatment needed. Not only that, but I will make sure that they have medical escorts on board. I mean, nurses, doctors traveling with them along the way, all the way back to home. Not only that, the hand washing for this basic social distancing, I mean, also is another. I mean, we were talking and discussing the other day. This is a concrete, a bus that was taking 50 migrants, now we are putting 25 inside the bus. The space between, so to absolutely apply the, so not only, if you look at the pictures that we publish every day on Volrep, you see all migrants wearing, and every 2-3 hours maybe the buses are stopped and they are hand washing all these issues. So, and then there is temperature measured, temperature taken before they board, and if someone develop any type of symptoms, yeah, so there is someone on board, and so this is a practical example. Not only that, the good news is, I mean, after the COVID-19, for example, resettlement has stopped, but also resettlement now has started, but with additional precautionary measures that, I mean, that I was mentioning, for example. All this applies not only for Volrep beneficiaries, but also for resettlement beneficiaries. I mean, again, you may have seen the photos, so distance, I mean, social distance, hand washing, and wearing face masks and all this, temperature taking. So we are doing that. Not only that, since we have a big team, actually, a big team of medical doctors and nurses in Tanzania, you may have heard about the Makere Processing Center in Makere, which is a very modern and very, how we call it, sophisticated health, has got unit actually health facility. We agreed actually globally IOM to provide, to assist the United Nations country team with provision of medical services that for not for the community, but for the UN staff and also their dependents. I hope really that it will kick off very soon. We have signed the agreement. So these are all practical examples. Not only that, but we provided motorbikes actually to the mainland, also to Zanzibar for contact tracing, and of course, if there's any case of COVID reported anywhere. But as you know, globally, the cases of corona in Tanzania are very, very few. I mean, we don't have, yeah.
The UN Secretary General has called for the building back better during the last decade of action. And IOM, how prepared are you in terms of reaching your goals, the sustainable development goals, which have obviously been affected by a number of things, COVID-19, and I imagine also the funding, because if you transported 50 migrants before and now you're transporting 25, it means you have you need more funds to support more trips of these migrants who are voluntarily returning. So I would like you to speak about building back better, issues around that, the SDGs, the funding.
Yeah. No, so thank you, Stella. Very, very pertinent. Of course, we are at the forefront. IOM is really at the forefront because, as I mentioned, migration, if well managed, it really positively contributes to both the receiving country and the sending country. Because very simple example. A migrant got job somewhere, went, is earning money. He sent to his family. Of course, he sustained not only a family, but he sustained. And this now has simply stopped. Not only it has stopped, as I mentioned, both regular and irregular migrants after the COVID, after the measures, I mean, preventative measures put in place. Many families abandoned, actually. Just imagine, after the explosion of these gases in Lebanon, I mean, this is the very recent example. I mean, many people, I mean, you see very horrific photos, actually, very, I mean, you will get, I mean, horrified images of migrants, actually, especially housemates, I mean, house helpers, who have been abandoned by other people. So this is I mean, COVID has affected so bad the migration. I mentioned that resettlement, which is one of the most important durable solutions for refugees, for burden sharing, for refugees to have a better future in their lives, I mean, forever, or returning to their home when there is peace, all has stopped because of COVID. So, of course, it costs us a lot. What we are trying to do is together, because this is about refugees. IOM is not the mandated agency for refugees, it's UNHCR. We are supporting the UNHCR as a sister agency to implement this durable solution. So it costs us more money. Of course, we are appealing left and right to get more funding. But IOM, as you know, both at country level and also globally, is part and partial of the appeals of building better. I mean, this has to be lessened. This has taught people that it's not only the poor country, or let me, the less developed country that need the developed world, but the developed world, I mean, COVID made everybody the same. Just imagine, the countries that are having more cases at the moment are not the less developed. Of course, everybody is worried Africa to be the how you call it, the main focus in terms of COVID-19, but at the moment, the main countries affected are the most developed, is like the USA and other countries that are really having biggest numbers. So it taught that there are, I mean, issues that will go beyond, I mean, the technologies or the money you have. So the solidarity, I mean, the being together, I mean, that you cannot do things alone, but everyone can contribute positively into solving the issues that we are facing. COVID is, and on one side, actually created a lot of problems, but on the other side, taught a lesson that the world has never experienced, I mean, before, because people really were not able, and are not able, some countries until now, to deal or to address the challenges created by COVID. So I would like to say that IOM is part and parcel of the, how you call it, the Secretary General appeal to build better. This has to be a lesson, I mean, to wake us up, a wake-up call, actually, let me put it like that, for every UN agency through its mandate, and not through duplication, and to focus on and to avoid all other things that divide us, and look for those who can unite us, and so that we can address these things, because yeah, it's simply, it's clear, actually. When I heard that some developing countries are sending testing kits to very developed countries, that was clear, actually, because they didn't have test kits. Yeah.
Yeah. So basically, you believe you're on track with the SDGs?
I believe IOM is doing its part, because this is a global, I mean, it's not, as I said initially when I started, migration or migration governance, let me be specific, can contribute to each and every one of the 17 global goals of the SDGs, the Sustainable Development Goals. Yeah.
And this one more thing, I know the borders are closed now with Uganda and Kenya. How is the trafficking going on now, or the smuggling? Is there any? What are the trends like now under COVID-19? Has it ceased? Or?
Smugglers have never stopped, actually. Their work have never stopped smuggling people. But this put more risk, actually, to because, as we said, smuggling is to enabling someone to enter a country that is not his country through fake means. I mean, either putting the person, just imagine, taking a container, locking 50 migrants inside a container, or taking a small boat, putting 100, and with that close contact and all this. So COVID, as I said, and I must repeat, I mean, irregular migration has not stopped. It has simply aggravated their situation. Many migrants, of course, are affected by COVID. Many migrants have died because of COVID, not only because of COVID, but in the situations they are in containers, in small boats, capsizing on high seas and all this, or abandoned, I don't know, on swimming, I don't know how they call them, these boats in those areas.
So as we go along, I just wanted to find out if IOM is already pushing for anything towards vaccination. I know we don't have any vaccine yet for COVID-19, but bearing in mind that the migrants are your main clientele, and you say that they have been affected by COVID-19 in many ways, is there any push to ensure that once there's a vaccine, the priority is also towards the market? Do you think there's any chance for them first to get this?
Of course, if they, you know what we look, by chance I'm a medical doctor, what we look at the vaccine is the efficacy and safety. These are two characteristics, actually, two features, actually. The vaccine has to be, first of all, safe. I mean, it should not cause, problems, because, vaccines are made either some toxic from the germs, or the germs themselves that are being, we call them attenuated. They are made not to cause the disease. Even now, the vaccine that they are trying to develop against COVID-19 is just the virus that has been attenuated, actually, which is it's part of that can cause the disease that they are trying to remove. So the thing is, it has to be safe, and for vaccine to be safe, it has to pass through many trials. There are several phases, the first phase, second phase, third phase, so, and thousands of people have to do it. So the vaccine, first of all, it has to be safe. So once, and we hear every day, really the good news, I hope it will, because you hear this country has discovered one that I don't want to mention now which countries. The second thing is to have efficacy, 100% efficacy. Not all vaccines have got 100% efficacy. It means it is capacity to protect the person that is receiving against the disease. So if there's any vaccine, because I don't think now at the moment there are trials that are going on, in China, in Russia, in many countries that are going on, but there's no, and rest assured, I don't have doubt, actually, because just to give you a good example, now the people that we resettle, the refugees that we resettle, IOM resettles in the United States, are given not only the vaccines in this, that are in this country, the sending country, let's say Tanzania. Many developing countries, including Tanzania, they use what we call expanded program of immunization, EPI, you have had. But these refugees, since they are going to America, the United States have got a different schedule, a different number of vaccines, depending, of course, of prevalence and incidences of some communicable diseases in their country. So refugees who are destined for resettlement receive more vaccines. Rest assured, if there's any vaccine, because the resettlement, the medical part of resettlement, let's say the USRP for United States, we are guided by the CDC, Centers for Disease Control in Atlanta. So we take guidance, we take orders from CDC when it comes. I'm sure if there's any vaccine that has been approved by CDC, they will be the first one, for example, to receive. And I repeat, the most important thing in every vaccine is safety and efficacy of the vaccine. Of course, the numbers will be an issue, because world population is big. Not only population is big, but maybe it will be now to what we call to start with the groups at risks. COVID, although it affects everybody, there are what we call groups at risks that include elderly people. That includes, how you call it, people with some underlying medical conditions like diabetes, cancers, I don't know, high blood pressure, any other medical conditions. It also affects more men than women. Because of some biological factors. So all these things need to be not only that, but also frontline workers, the medical people who are dealing, actually also make them, as you know, they are, I read many articles that they are became more victims, I mean, than anybody else, that because that has been affected by COVID. So I mean, there will be, it will, I think a concept of prioritization should be applied, of course. I mean, there will not be, I mean, billions of vaccines at one day. They will be, I mean, produced by, and IOM, rest assured, I mean, because, I mean, resettlement, let's say, repatriation, all these durable solutions, there are three. It's local reintegration, return to their home countries, and also resettlement are done in line with international standards set by WHO, the World Health Organization, and other leading WHO collaborating agencies like the CDC. So I'm hoping really once there is a vaccine that is safe and has got good efficacy, that IOM will be among the first to put it in place.
I need some more clarity with the resettlement topic. With regards to Tanzania, when do you resettle, for example, a migrant who has come from Burundi, and when do you ask this person to go back home?
Very, very, very pertinent question, in the sense, I mean, what we resettle are not migrants. People who are resettled are refugees, and this we call them, I mean, durable solutions. So resettlement is particularly for those cases who require protection. Protection, I mean, which is the mandate of UNHCR, because refugees are not under the IOM mandate, but we support, let me put it like that, we work together with UNHCR to put it in place, because it has phases. First of all, it's UNHCR, I'm talking about resettlement at the moment, it's UNHCR that refer cases among the refugees to the so-called resettlement countries, and they are traditional resettlement countries like the United States of America, like Canada, like Australia. These are countries that are made, all of them made of people who have immigrated actually. But also Europe now is taking many migrants. Also some Asian countries are taking how we call it, people for resettlement. Now the resettlement, why someone, for example, is allocated for resettlement and why someone is allocated for vulnerable. Although it is, I mean, a response that UNHCR is supposed to give, what I know is about protection. Protection means the person, even if his country is peaceful, his life is in danger actually. The person who is going for resettlement is the person who needs really, but their protection, I mean, protection could be also because of medical conditions. Let's say someone has got a medical condition that cannot be handled or managed in his home country, let's say some cancers, some very complicated medical issues. So these people, these refugees, are referred for resettlement by UNHCR. Let's say someone is, I don't know, a politician, and if he goes back, for sure, I mean, either he will finish his life in prison or he will be killed. So this is again a case of protection. Not only that, but yeah, many other issues that you know in many countries that are not accepted, so that could lead to the protection. And yeah, when it comes to normally voluntary repatriation is when your home country, the home country of the refugee, is peaceful, and there is no risk actually that if the person goes back, his life, his how we call it, survival will be in trouble. Then is when these other people who theoretically become then the, how we call it, the beneficiaries for and it is the largest actually. Not all, if you compare in terms of percentage actually, resettlement is 3 to 5%, while the return is the major one actually, is almost 90-95% of the durable solutions for refugees. So now, in case, to give you practical examples, the refugees that we settle in the United States, they are not from Burundi actually, they are from DRC, Democratic Republic of Congo, and they are refugees who have been in Tanzania for almost, now this is the second decade, for more than 10 years they are here actually. While the refugees that were IOM together with UNHCR are returning to Burundi through the voluntary repatriation, are refugees who came during the last election in Burundi actually. The last election that caused a lot of problems and people had to flee. Not the recent one. The recent one was okay, everything was fine. So the other one is the one that caused people to flee because there were many people who have been unfortunately killed and had to run for their lives. Although this is so, to summarize, there are 3 durable solutions for refugees, and these are implemented by UNHCR. IOM simply support UNHCR to implement them, and they are the voluntary repatriation, local reintegration. I must say actually that Tanzania is the only country that I know in Africa that has given reintegration actually or citizenship to refugees. As you know, almost 200,000 refugees from Burundi have been given citizenship by Tanzania. So not many countries, apart the developed world, Tanzania in this sense is really leading. This really shows how good Tanzania was and is for the refugees. When it offered this solution for Burundians to be given citizenship. Yeah. So I came to Tanzania. This is what impressed me more actually in my career, let me say. How this system is working. How Tanzania, the United Nations country team, is really a good example. I must say, if not the best, is one of the best in the world. And this does not come, without a price. I'm sure this is a commitment from each and every member of the United Nations country team that is committed to give and also take, because so that we can promote, we can complement each other. We can, so that all what we are doing makes sense, and we don't duplicate things, we don't compete, and all the things. So this is one thing that I'm very proud to be part of this United Nations country team that is delivering, and also to the United Nations resident coordinator and DOs now, Alvaro, and also Zlatan at the moment. I was fortunate to see both of them, to work with both of them.